Now we have the last presentation for the session, Dr. Mahitha Narayanan on Does Cataract Surgery Increase Risk of Sequential NAIO?
Good morning all. My paper is on Does Cataract Surgery Increase the Risk of Sequential NAION? So, non-arteritic anterior ischemic optic neuropathy is the most common cause of acute optic neuropathy above 50 years, and the exact pathophysiology is unknown but thought to be due to hypoperfusion of short posterior ciliary arteries causing acute ischemia to optic nerve head. So this acute ischemia to optic nerve head lead to axonal swelling, compromise the axoplasmic flow and compression of optic nerve head microcirculation leading to ischemia and as a vicious circle causing compartment syndrome, later leading to infarction and death of retinal ganglion cells. Optic nerve head perfusion is mean arterial BP minus intraocular pressure. Anything that increase the IOP or decrease mean arterial BP can lead to ONH perfusion pressure imbalance. So we have to avoid nocturnal hypotension in patients who are taking antihypertensive at night have to be avoided. So the risk factors, mostly vasculopathic risk factors like hypertension, diabetes, hypercholesterolemia, smoking and obstructive sleep apnea is considered. Other risk factors, medication like phosphodiesterase inhibitors, disc at risk like small ONH with small CDR and optic disc drusen. Our aim of the study is to analyze if cataract surgery increase the risk of sequential NAION. So we collected the data retrospectively, retrospective cross-sectional study with 88 patients with documented NAION aged above 40 years who came to our tertiary care center between January 2013 to January 2023. We included the patients who had undergone cataract surgery and those who didn't. Systemic risk factors were considered. Out of the 88 patients, 37 had undergone cataract surgery, 51 without cataract surgery included. We collected data retrospectively from the EMR of patients with NAION, and presence of risk factors included. We taken the clinical history, fundus photograph, HFA except in poor vision patients, OCT and MRI brain to rule out other causes included. Cases with findings not confirmatory for NAION were excluded. And the parameters assessed were demographic data, visual acuity pre and post cataract surgery, RAPD and color vision, eye and the type of surgery, systemic risk factors, and if any other ocular surgery done during the study period. Follow-up was 6 months. So the results, male outnumbered females in our study. The mean age was 65 years and 37, that is 42% undergone cataract surgery. Systemic risk factors in 75.7 patients were known, and diabetic was the most common systemic risk factors. So 42% of our population had undergone the surgery and 60 didn't. NAION in same and contralateral eye was 81.1 in contralateral and 18.9 in same eye. So best corrected visual acuity prior to surgery was 6/24 or worse in majority, and best corrected visual acuity 6 months follow-up period was 6/9 or better. The type of surgery done, phacoemulsification in 95% and 5% had SICS. No intraoperative complications were noted, and no one had any other ocular surgery during the study period. Out of the 88 patients with NAION, no one developed NAION in the contralateral eye during the study period, and in the group undergone cataract surgery also, nobody developed NAION in the same or contralateral eye during the follow-up period. These were the studies we considered. In Lamby et al., the retrospective cohort study, 325 patients with 17 undergone cataract surgery, 9 among them developed NAION, and without cataract surgery, 308 patients, 59 developed NAION in contralateral eye. In McCull TJ, the incidence was 51.8 out of 1 lakh in 6-month follow-up period and 34.6 per 1 lakh in 6-week follow-up period. So our observations with modern cataract surgery techniques and instrumentation lacks fluctuation in the anterior chamber and intraocular pressure and good postoperative follow-up. Post-cataract surgery, optic neuropathy due to NAION has been minimized and systemic risk factors were well controlled. The limitation of my study: retrospective nature, low sample size, short follow-up period, and some variables not known were exact time of anion development, exact cup disc ratio, metabolic profile, and smoking history. Long-term follow-up is needed to assess the stability of results. So, concluding, cataract surgery did not increase the risk of sequential NAION in our study. These were the references. Thank you.
Do you take BP for all the patients? Blood pressure.
Yes, on the coming to the
Did you measure the CRA pressure, the blood pressure?
Sir, it was a retrospective study, so it was in the EMR, most of the patients.
Any blood pressure of CRA was calculated. Do you know how to calculate?
Not in all patients.
No, do you know how to calculate CRA BP?
CRBP in...
Central because you told perfusion pressure based on the arterial BP.
No, we didn't. In ICU and all.
Do you know how to be record?
No, sir.
No. We
I have seen, but
ophthalmic dynamometer was there those days.
Okay.
We were measuring the that is a BP of CRA with ophthalmic dynamometer. And if you are not having that, you are taking BP, normal BP.
Yeah.
You take 2/3 as systolic,
Yes.
and half of the systemic is diastolic, approximate. Then IOP. You can calculate the perfusion pressure.
Yes.
Okay. Thank you.